everyone, this is Tosha and you're watching TO Q&A sessions. And today we'll be talking about some really crucial matters about dental health. And for that we have Dr. Sanket Chakravarti with us today, and he's one of the most sought after dentists in Kolkata. I welcome you, sir. So my first set of questions would be on dental implants. So what exactly are dental implants?
Dental implants are a surgical component which interfaces with the bone to support dental processes like dental crowns and dental dentures.
Are dental implants safe?
Dental implants are quite safe because we are using grade 5 titanium, which is also being used in other medical fields, and it has proven success because titanium is a biocompatible material which also has the ability of biomimicry, which makes the deposition of bone around the implants quite safer and at a quite faster rate.
So what indication does a patient show when you actually suggest them to go for a dental implant?
See, when a patient is not having any teeth in the mouth or having only few teeth missing, in such cases we are advising the patient to go for dental implants.
Okay. My last question for this phase would be, how much time does it usually take for somebody to get a dental implant done?
See, we are doing dental implants in two concepts. One concept involves single sitting implant procedure, in which on the single day we put the implant surgical and then go ahead with the processes loading part, which is also done in the same. That is the reason why it is called a single day implant.
Right.
Whereas the second concept, which involves delayed implant loading, in which we surgically put the implant and then wait for the osseointegration. That means the deposition of the bone around the implant. That is called as osseointegration, which normally happens in 1 to 1.5 months. Sometimes in some cases it happens in 2 months.
Okay.
So once that is done and we have checked it radiologically or by X-ray, then we go ahead with the prosthetic part, which is a very safer prospect in terms of implant treatment.
The second part of our discussion will be on removable dentures versus fixed dentures. So, what are the different types of dentures?
Different types of dentures normally involves two types, in which the first one is called as removable dentures and the other one is called as fixed denture.
And how are these two things different?
The removable denture is something in which a patient has to wear and remove, whereas a fixed denture is something which is fixed in the patient's oral cavity for years to come. A removable denture is something what the patient has to wear and has to remove. This type of denture is called as removable denture. A fixed partial denture normally involves the help of dental cements to get fixed to the teeth, and it stays together for at least 10-15 years easily. A complete denture is a denture which is being given to a patient who has lost both the sets of teeth. It can be single denture or else both the sets also can be given. A complete denture derives its retention with the help of the bone as well as the gum support. Nowadays, dental implants are being used to give much better support for such type of dentures. A metal denture is a denture in which we use different types of alloys such as cobalt chromium. Sometimes we also use nickel chromium, but some patients have allergy to nickel, so we use cobalt chromium. Nowadays, titanium also is being used. Why do we need metal dentures? Because metal dentures gives us much more support as well as strength, wherein in some cases the dentures has a tendency to break frequently. In such scenarios, we are giving metal dentures. A flexible denture, it is made up of Valplast material, which has the property to flex. Also, some fibers are there which helps it in flexing and is unbreakable in denture, as you can see over here.
So, when are these fixed dentures indicated?
See, fixed dentures are indicated in scenarios where the gum conditions and the bone condition of the patients are absolutely alright. Where you have a sound supporting tooth or teeth, which helps in maintaining the longevity of the fixed partial denture. In such conditions, we are taking fixed partial denture.
So, what are the different types of dental crowns and dental bridges which are available?
See, there are new innovations which have come to the dental field now. What we are here are going to show is a metal ceramic bridge, which is normally consisting of a metal coping, and then on top of it a ceramic coating is done. Here we are talking about metal-free fixed partial dentures or FPDs, in which the coping is made up of a ceramic coping and the layering is done by a ceramic. It is lighter than the metal ceramic, and cosmetically it is much better than metal ceramic because it is translucent in nature. Now in both the type of bridges what we have shown, zirconium is the most modern bridge system what we are presently using. Why? Because it is much more consumer friendly, it's more cosmetic in regards to metal ceramic bridge, and all ceramic is extra lighter than the metal ceramic.
So, the third part of our discussion will be on smile designing. So, what exactly is smile designing?
Smile designing is a process in which we cosmetically recontour the anesthetic teeth, either by doing cosmetic filling or with the help of cosmetic crowns. For example, zirconium or the metal-free crowns which we had discussed earlier. It is a procedure in which we take very less time to give instant results, and nowadays it is being used in bridal makeover that can be done in say in a period of 5 to 7 days.
So, how much time does it take and how many sittings does it take for someone to get over this?
See, in the first appointment, we normally ask the patient what they really want with their smile and their looks. Then we go about in making a model to show them how the treatment will be done and what are the aspects of. We discuss the different aspects with them. That hardly takes 2 days. After that, once the patient has given a approval for all the makeovers or the makeovers which we have done shown in the demo model, then we go about the process, which normally takes around 5 days after that.
How is it different from dental braces?
Dental braces takes a long time, whereas smile designing is done in a week. Dental braces is is a treatment of choice for severe cases wherein we cannot use smile designing for severe cases, which actually depends upon the clinician who is seeing the patient.
Okay. So, it was wonderful having you over here, and you've been so generous and informative, and we have all our queries answered. So, here's a little bit of appreciation for our side. Thank you all for being here, and I want you all to follow Tio on Facebook, Twitter, LinkedIn, YouTube, and be there with us. Bye bye.